Hi guys, long time no see. It's your girl Queen. I'm back and stressed. Just kidding. We're not stressed. We got God on our side. We are kicking NP school's butt. Okay, so I know it's been a while, but I'm back with some questions that I got ChatGPT to write up for me. Some people did ask some questions in a couple of my other videos, and I was going to touch on some of that as well. So let's get started. Let's jump right into it. First question is, how did you find and secure your clinical preceptor? First of all, let's start with where I'm doing clinicals at right now. Right now, I am doing my clinicals at a health department. I drive about 2 hours to get to this health department. My brother's in that town, so I just stay with him like 2 or 3 days out of the week, and I go there two times a week. And it wasn't really hard to secure that clinical because I kind of networked it. Sorry if you hear my dog sniffing over there. But I networked and got that one. I used to actually work at that health department, so I was able to kind of communicate and network with some of the people that are still there that I know. And the old manager that was there, she's still there, and she kind of hooked me up with that. One of the ways I tried, I Googled, of course, every women's health OB GYN office in my city, in my mom's city, in my brother's city, and anywhere like around. And I made a list in my phone, and then I just was call, leaving voicemails. I was able to talk to a couple of them, but mostly I was leaving voicemails. And I got maybe two calls back, and they were just saying they didn't have any openings. One of them said that they weren't taking any students, and then I kind of got discouraged, I'm not going to lie, so I gave up for a little bit. And then the school kind of got on my tail, and so I was like, okay, let's rev this back up. Let's try it again. I then Googled, this might sound crazy, I Googled Black women's health providers near me, because I just felt like maybe someone who would look like me and know the struggles that I have. And just, if you're African American, you get what I'm trying to say. And I reached out to one, and she actually reached out back to me. I emailed them, and they emailed me back. They asked for all my information. I had a meeting with her assistant, and then I had a meeting with her last Friday, and everything went great. And she agreed to precept me for fall. So starting in September, she just has to get all the paperwork filled out and everything. And she was possibly hinting at the possible job afterwards. So let's hope that works. But another way that I've seen people trying to get preceptors, there's a Facebook group called, let me tell you guys, because we are not leaving anything out. I want all of y'all to be successful, because maybe you can start earlier than I did. I started kind of late because I knew I had one secured. I knew I was going to work at the health department, and I thought I could get them a second time, but my teacher was like, no. It's called Nurse Practitioner Students in Need of NP Preceptors. That's the name of the group. It's probably backwards, but that's what it looks like. At first, I posted a regular post. Regular posts don't do anything in that group. Do not do a regular post saying what you need, how many hours you need, blah, blah, blah. People will not look at it. Someone else had posted something with a picture in it, and I was like, they had a bunch of comments. It looked like a resume. I don't even know what you would call it, but it looked like a resume. So I was like, this is how I can get traction. So I did the same thing. So I made one of these, and it got a lot of traction. It's still getting traction. I'm going to delete it very soon. It's because I kind of already have my clinicals laid out for the rest of the year. But yeah, make one of those. Say exactly what you need. You can put your work history on there. You can put your education history. You can say the perks or the benefits that the preceptors get if they do precept you. Some schools offer, I forgot what it was called, an honorarium or something like that. My school doesn't. But yeah, so that was how I did that. It was a struggle. Start early. Start as early as you can. Just start as early as you can trying to find preceptors. That will make it so much easier on you and less stressful, because I was very stressed, and it stressed me out to the point where I just stopped. But I prayed about it, and I asked God to help me. Like, please, God, like, if this is something that I'm supposed to be doing, please just help me do it. Like, I'm going to try to put in the work, and you just help me. And he helped me. The next question says, what settings are you completing your clinical hours in? I kind of already answered that. I'm doing the health department right now. So that's family planning, STDs, birth control, stuff like that. That's kind of the majority of what I'm doing now. And I would say, maybe this is because I've worked at the health department before, but it's very kind of redundant. It's the same stuff that I've seen when I worked there a couple years ago, 5 years ago. Was it 5 years ago? Oh my gosh. It's the same stuff that you would see as an RN at the health department, with a little bit of IUD placements, Nexplanon placements. So it's kind of like, if you're into that, it would probably be a good first job, you know, just to get some experience, like as an NP. But I don't know if that was something that you would want to ride out your NP career in. I don't know, but to each his own. Next question. How many clinical hours do you need to complete in your program? So each quarter I need to complete 160 hours. So in total, let's do the math. I have 4 quarters that I have to do clinicals. So 640 clinical hours, which is a lot. So what I've been doing is 2 days a week. Every now and then I have to do 3. Every now and then, not many, but usually it's 2 8-hour to 9-hour days. But we can do up to 10 hours. You can't do any 12-hour shifts, but we can do up to 10 hours. So however you can work it out. They just don't want you to do all of the hours on the front end. So if you can kind of space them out as much as you can, that's fine. But when I've had to do 3 in a week, I didn't get any pushback. Next question. What does a typical day look like during clinicals? So for the health department where I am now, the clinicals tend to be more, is the word mundane? Let me Google mundane. Yes, mundane, lacking excitement. It's a great place to get your contraceptive learning on. You hear me? Like, you're going to do some birth control pills and depot every other patient. So I'm getting really good at that. Like, depot, good. Pills, good. You learn, hey, do you have migraine with aura? Do you have blood clot history? Have you had a stroke? Are you over the age of 35 and smoking? Oh, you can't have depot. Or you can't have combined hormonal contraceptives because that would not work. Like, you learn a lot of that, which is good. Not saying that that's not good, but it's very, you keep doing that over and over and over and over. And the RNs in the health department do that. So the MP is kind of functioning as a higher level RN there. Just getting paid the good money. You know how health departments are. But she's getting paid basically MP money to do an RN's job, other than she does a lot of IUD placements and Nexplanons. So that's pretty interesting. We've had a lot of IUDs. So I have been doing some pelvic exams, those breast exams, bimanual exams. So that's been pretty cool. You'll get very proficient at the health department. I still think it's a great clinical because you'll get very proficient in the pelvic exam part of it and the breast exam, because you get a lot of annual visits as well. So you'll get very proficient in those, and the 21 and up girls, pap smears, like all of that. So I think that is a very good place to do clinical. So if you have your local health department near you and you want to do that for your first round of clinicals, I think it is amazing for that. Like, it's a lot of repetition and you will get everything on point. It's just that I have kind of already did a lot of that. So it's not super beneficial. I am still coming at it from a different viewpoint now, but it's still, it gets kind of mundane. Next question. How do you stay organized and track your hours and experiences? So my school has a website called Exact, and that's where we log all of our patients. So I have a little notebook, because they don't want you really logging the patients while you're in the room, of course. So I have a little notebook and I just write something simple like their initials and their age, and then the main things that we kind of did in the procedure or in the patient's room or whatever. And then I'll go back and I'll chart that at the end of the day. That's how I keep up with that. And we have logs as far as what dates you will be doing clinicals. So you can log all of those dates and make sure it equals up to 160 hours. And then if anything changes, you can always kind of edit it and switch days around. But they like for you to kind of plan out your days ahead of time if you can, if that's possible with your preceptor. You just have to kind of get in with your preceptor and see, do they have their schedule made out? Maybe they're on a every 2 week schedule, or maybe they're on they do their schedule a month out. Like, just kind of go with your preceptor and kind of see how they do it. What are your clinical goals for the semester? So for this semester, or this quarter for me, I really would like to do an IUD insertion. I've seen a couple with my preceptor, and I would really love to do at least one while I'm there, but it's so nerve-wracking. I don't know. I mean, I've been assisting, but I would really love to try to do an IUD insertion on my own. But I'm also very nervous to do that because I don't know where you guys are in your NP journey, but using the tenaculum to pull the cervix back just really freaks me out. Yeah, but that's something that I would really like to try. Next question, how do you handle being corrected or given feedback by your preceptor? I haven't necessarily been corrected yet, but I have been given feedback and I take it very well. I really love my preceptor. She's amazing. She's very easy to talk to. I feel like I can ask her any questions, and any feedback that she's given me, I've taken in a positive way. That does matter. Your preceptor's attitude matters because that'll make you feel comfortable if they're comfortable with you. So just you come in on time, feel their vibe, see what type of person they are, and then just try to match energy. And if it's positive energy, match their energy and keep it pushing, and you should have a great experience. What's something you've learned in clinicals that textbooks didn't teach? So the textbook is going to teach you textbook knowledge. The real world or clinicals, you'll start to learn what people do in the real world. And it's not always going to be by the book. You'll have your guidelines, but you also have to participate in shared decision making with the patient. You'll have the guideline, but what if this is something the patient doesn't want to do? So now what? You can't just force them to do something they don't want to do. So you have to kind of learn how to manipulate your guidelines while still remaining legal and providing the proper care for your patient, while also trying to add in what they want for themselves. So I've seen my preceptor do that, and I really think she does a good job at that. And that's something that I really want to kind of get better at doing, because it's like you're still doing it the right way, but you're also keeping the patient in mind. Are you seeing OB patients, GYN patients, or both? I have not seen any OB patients except one. I saw one patient that was like, I think 8 or 9 weeks pregnant. She just found out she was pregnant, and she was just in there for an STD check. But other than that, we don't see any OB patients there. They used to have a program back when I used to work there for pregnant people, but I guess they lost funding, so they don't have that anymore. That would have been really cool. So it's pretty much just GYN and birth control, all that type of stuff. Let's see, next question. Do you ever feel nervous or underprepared during clinicals? How do you cope? I feel nervous every day I walk in there, just because you never know what you're going to get. I don't feel as nervous as I feel as an RN doing clinicals, or as a student nurse. Before I was even an RN, I felt very nervous then. But now, since I'm an RN, I've been an RN for 8 years, I don't feel that type of nervousness. It's more of, I hope I can be as good as my preceptor is one day. Like, that's how I feel. I feel like it's almost imposter syndrome. But I feel like it's also something that I can get through. It just all feels so surreal right now, just because we're new at this. I'm new at this. Like, this is my first clinical as a provider, student provider, whatever you want to call it. And it's just a whole different lane. I usually just pray about it. Like, I'm sorry, that's all I can say. Like, I just pray. Praying calms me. Praying reminds me that I can get through anything. And that's my advice to y'all, is to just pray about it. If you don't know God, get to know him. He helps, like always. What advice would you give to women's health nurse practitioner students about to start their first clinical rotation? So my advice would be, make sure, I'm going to start from the basics. Make sure you have clean, fresh scrubs. Make sure you look presentable. Make sure your hygiene is on point. Make sure you have your name badge. Make sure you have pen, paper, notebook, whatever you're going to bring. Do not bring your laptop in there unless your preceptor agrees for you to do that. Don't bring that immediately because it looks like you're coming in just to do your work. Don't do that. Don't give out that impression. Maybe an iPad, because it's smaller, you can kind of hide that away to kind of assess the vibes, but don't come in doing that. Come in showing initiative, that you're willing to learn and that you're willing to get hands-on experience. So the preceptor will know, like, okay, this person's here to learn. This person's ready to learn because they're willing to teach or they wouldn't have taken you. So make sure you're coming in with that type of vibe, that type of mindset, that look, presentable, professional, no phones. Don't have your phones out, like I said, unless you assess the vibe of your preceptor and you feel like it's fine and she's fine with it. That's different. But do not come in there your first day, first couple of weeks with that type of vibe, because you do not want to give off the wrong impression, because they do have to evaluate you. They do have to communicate back and forth with your teachers. So you don't want a situation where you're too comfortable and then they report back on you and now you're screwed. This is a question from one of you guys. Okay, so here's the question from Renetria? Maybe it's Renetria J. Sorry if I said it wrong. Can you do a deep dive on what the clinical days look like, procedures you see, conditions and patient population, disease specific? I'm really considering WHNP and would love to see what clinical day looks like outside of pap smears and STI testing. Girl, like I said earlier, that's kind of all we're doing right now because I'm at the health department. Next quarter is going to be perfect for me to make a video because I am doing clinicals at a fertility clinic. So that ought to be interesting. Like that's going to be different. And I'm really excited to kind of share that with y'all. And I really feel like I'm going to learn so much there, and I'm very excited about that. But as far as what a clinical day looks like, I usually come in, I get there about 7:50 because it opens at 8. Get in there about 7:50. The health department is kind of slow. It gets kind of slow start depending on the day. Mondays are usually slow and Fridays are usually slow. But you come in, I get with my preceptor. She's checking her schedule for the day. We'll look, they call her name over the intercom. That's how she knows that she has a patient waiting on her. So then we'll call the patient back to the room. We'll go over, because the paperwork will say what they're there for, and we'll kind of check and see if they've been there before. And it's usually more birth control related. They want a refill, or they need a depot shot, or they want to start a depot, or they want to start pills. We have a lot of STD visits. They'll come in needing an STD check. We do a lot of STD treatment, so it'll just say treatment on the paper, where we'll give them treatment for chlamydia, gonorrhea, syphilis. We don't do any herpes testing there unless they have a lesion, which I thought was pretty interesting, because back when I worked at the health department, we would do herpes testing by blood, but there they want you to swab the lesion. So I don't know, I guess that's more a mental thing for people, because you get a lot of false positives with herpes testing. So I'm assuming that's why they do that now. They want you to actually have a lesion, because at that point you know something's wrong, versus just drawing blood and having the possibility of a false positive. I don't know. Annuals, we do well woman exams. So that's basically like just the full physical for a woman. IUD insertions sometimes. I haven't seen an Nexplanon done yet. Every time she has one, I'm not there. That's pretty much the day. We just do that all day. We have like a couple patients a day, and that's what we do all day. Pap smears, done a couple of those, pelvic exams, and that's just the vibe. So it's really good for repetition at the health department. So that would be a really good place to start. But like I said, when I go to this fertility clinic, that ought to be interesting because it's more specialized. Patient population, it's usually more African American people, a couple of white people. I have some Hispanic people, and that's pretty much it. I haven't seen much of any other race now that I think about it. And mostly female, of course, women's health. But we've seen a couple of males just because STD visits are taking place there, and some kids when it comes to immunization. Sometimes she has to run over to the immunization clinic and they have to do that. That's why I said she kind of functions more as an RN there in some aspects, because she's still doing a lot of RN things. Definitely stay in tune with the channel, because there's definitely going to be some pretty interesting stuff coming up, because I have the clinical set up with the fertility doctor. So it's not just specifically OBGYN fertility type stuff, it's also GYN stuff too. So that'll be really interesting. And then she's going to set me up with a GYN to do some clinicals as well. So that'll be interesting. I'll get to see more of like what happens when the patient with abnormal bleeding comes in. What do we do now? Because at the health department, they refer them out to the GYN person. So it'll be cool to kind of see what happens when you do refer them out, or what happens when that pap smear isn't like normal, or what happens when you find that breast lump. Because at the health department, all we do is refer. It would be nice to see kind of what happens after. So I'm interested in seeing that as well. I'm gonna save y'all the yap sesh, but yeah, midterms just passed. I did good. I passed my midterm, so now we're in the second half, and by the end of September I'll be in the fertility clinical rotation. So you guys, it is moving fast. I'll graduate next June 2026. I hope you guys enjoyed this video. I hope I answered some of your questions. I hope I eased some of y'all's minds. I hope I explained some things that you were really freaking out about. It's fine. You don't know anything other than what you know. That's all I can say. And what you don't know, that's the whole point of a preceptor, to explain to you and teach you. So if you go in with that mindset, not thinking that you know everything just because you read your book, you'll be fine. And pray to God that he gives you peace, he gives you comfort, he gives you the knowledge that you're supposed to have, and if you don't have it, that he sends the person to give it to you. Okay, you guys have a good rest of your night. I'll talk to y'all later. Bye.